Hi, this is Dr. Tom Rogers at Performance Medicine, coming to you on Sunday afternoon doing the weekly dictations. Today we're going to talk about something that I see a lot of in the office, and that is hair loss in women. Now, we all know for men it's usually a genetic thing with male pattern baldness and all, but in women it's a totally different thing. And it really shouldn't happen because there's usually an underlying medical condition for this. All of us experience hair loss every day, generally between 100 and 250 strands of hair that we lose. Now, sometimes if you're seeing clumps in the shower, and again, this is for women, or you notice you're getting thin up top, and then you can come to us and we can try to figure this thing out and treat it, because in men sometimes it's harder to treat. In women it's fairly easy to figure out and treat. I won't say easy because sometimes you do have to dig, but and there's a lot of causes for it. But anyway, for women there's several things, and usually it's hormonal. Of course, pregnancy, menopause, those hormonal times of your life when there's a lot of changes in your hormones up and down, or loss of hormones can cause it. And typically hair loves estrogen and progesterone, typically not so much with testosterone. So if you're using testosterone in women, which you should, because women need it just like men do, you have to be careful that it doesn't aromatize or switch into dihydrotestosterone, the hormone that's responsible for male pattern baldness, and in women as well. Although in women it's usually just thinning hair, not bald spots like you see in men. But for women especially, it's very psychological. It's damaging to their psyche. There's no physiologic reason that you need to worry about with hair loss. You can live with hair loss, male or female, but psychologically it's really damaging. And usually in females it does signal that there's some kind of either hormonal or stress-related condition, maybe autoimmune, that's causing this. So in women, pregnancy, menopause, anemia, low iron can cause hair loss for sure. I always check ferritin levels. Everybody knows stress can cause hair loss, sometimes rather rapidly. All the changes with stress can cause oxidative stress, and it can affect blood supply to your scalp especially, and sometimes preferentially to your scalp, because the other areas that are critical to living may be spared, but hair loss, you can live with that, so sometimes that's the first place it'll show up. So eating disorders, of course, that anorexia and bulimia can cause hair loss. Vitamin and mineral deficiencies, protein deficiencies. If you're not eating enough protein, I see this in vegans a lot, then you may experience a lot of hair loss. Of course, hypothyroid. I do a ton of work with thyroid in my office, and a lot of women have been told they have a normal thyroid when in fact they had a very low thyroid. For some reason, a lot of docs are just hesitant to put you on thyroid medications, and they may not know even about natural thyroid medications that you can use. But normal to me means nothing. Optimal means something. So always listen to your patient and use the labs in context with the symptoms. So birth control pills can cause hair loss. A lot of medicines can cause hair loss, especially steroids. Autoimmune diseases, which women are much more likely to come down with, can cause hair loss, like lupus, rheumatoid arthritis, Hashimoto's, etc. Hormones, which we've talked about. Look at PCOS. You get hair growing in places you don't want them, and you lose hair where you want it, on your scalp. B12 deficiencies, which are so common. A lot of extreme sudden weight loss. Even with any diet you can lose weight. Usually that comes back pretty easily once you get your nutritional status back to normal. Of course, dandruff can cause it. Trauma, any kind of trauma or surgery can cause it. Too much vitamin A. You need vitamin A for hair, but too much of it ironically can cause hair loss. And again, genetics can play a role in hair loss, male or female. So you have to look at these things. Now, so what you need to do is find out why you're losing hair, and then let us guide you to getting your hair back. Of course, medications for it, Rogaine, which comes in gel and foam, it's pretty good for maintaining some hair loss. You have to keep using it. Propecia, which you think of using in men, sometimes in postmenopausal women, I'll use a little bit of that. You can't use it in a woman who could have a child. But certain shampoos help. We have some at the office. The favorite one is Ontogeny C, and we have one called Anaphase. It'll get the hair stimulated, and I'll talk about that in a minute. But so certain shampoos do help. Laser combs, I haven't found them to be that effective, but maybe about 12% effective is what I've read in the literature. So you can buy those. They're expensive, but not that effective, I don't think. Coconut oil really helps. I think coconut oil is an amazing product, but you can use that in your hair, and it really helps. As a last resort, of course, you can have surgery for it, but rarely do I have to send women for hair loss surgery. In the office, I do a procedure where I use PRP, platelet-rich plasma, where I draw the blood from your arm, spin it down, get the platelets off of it, and I inject it into the scalp if nothing else is working. And that's been a fairly effective tool for regrowing hair. And Kelly as well uses microneedling, either of PRP or certain stem cell products that she gets, and that's an amazingly effective way to kind of stimulate your hair to grow. And remember, when you're shampooing, this is something I forgot to tell you, but massage your scalp really well. That helps your circulation, and your scalp is about the circulation and reducing oxidative stress and replacing those vitamins and minerals that you're losing. As we know, a healthy lifestyle like drinking a lot of water, exercising, getting a good night's sleep, handling stress, all really go towards preventing hair loss. And a lot of, when we look at a person, we always look at their face and we look at their hair. We can kind of tell how old they are from that. So there's a lot of stuff you can do. Vitamins you can take, of course, everybody needs biotin, and probably all the B vitamins. I use a B complex in addition to a little bit of biotin in everybody that has hair loss. Certain amount of vitamin A, don't go over 5,000 international units of that, or it could make it worse. And the old standby is C, D, and E, and a special form of vitamin E called tocotrienols. We use them a lot in the office. And if you're deficient, we use iron. A little zinc always helps. It's great for autoimmune diseases and for preventing certain illnesses like viruses. And we use a thing called protein collagen. I stir some in my coffee every morning, and it's just a great thing for hair. Collagen is a component of hair. And watch out for DHEA, which is an over-the-counter vitamin. It's a good vitamin. It's actually a precursor to testosterone in women, but I found that a lot of women cannot tolerate DHEA because it causes some hair loss. So if you're using that and you're experiencing hair loss, stop it and see if you get better. So there's a lot of things you can do, a lot of little procedures that we do, but find out the underlying cause. There may be a medical issue and that we can correct. Look at your vitamins and minerals. Look at other medications you're taking that might have caused it in the first place. And there's no reason for women to keep losing hair. You need that beautiful, luxurious hair that's a good texture and all. Certain aging, certain aspects of aging can cause hair to be more brittle, more thinner. So you can definitely bring your hair back. I love to work with women on their hormones, of course, and also those nutritional and vitamin deficiencies that they have. So if you're a woman who's having some hair loss, come into our offices and help us try to figure it out for you and treat it. Okay? Any questions? Don't hesitate to ask or call the office. We'll see you next week.